people, welcome back to my YouTube channel. It's been long. Thank you all to my subscribers. In case you haven't subscribed to my channel, kindly subscribe. This is a channel where I cover practical applications of monitoring and evaluation concepts and project management and planning. So today we're going to look at the application of the citizen report card in program evaluation. We're going to deeply understand this concept and how to apply the citizenship report card in our programs evaluation. So just a brief about the concept of the citizen report card. This originated from Bangalore, India in 1994. This was an independent NGO that came up with this concept. So this compass was to mimic the private sector practice of collecting consumer feedback and applying it to the context of the public goods and services. So they derived their name from that manner, and data was presented into a citizen report card, which is in simple just a powerful social accountability tool that can be used to solicit user feedback on service provider performance. That's briefly about the citizen report card and its background. And during the citizen report card process, qualitative and quantitative perception-based information is always representatively used in surveys. So what exactly is a citizen report card? You've known the background. It came from India in 1994, adopted by an NGO which wanted to mimic public sector service delivery, a social accountability tool. So this is a tool to provide public service agencies with systematic feedback from the users of public services. This is done by feedback on the quality and adequacy of public services from the actual users. For example, we have a public service which is Umeme and National Water. So a citizen report card is a tool, social accountability tool you can use to survey people, asking them about the service and the performance of maybe Umeme and National Water. How is it accessible to all locations or areas? Is it usable? Are they facing any challenges? How do they want to improve such services? And from there, social reforms are adapted or improvement in the public services is done. So the CRA provides a rigorous basis and proactive agenda for communities, civil society organizations, or local governments to engage in dialogue with service providers to improve the delivery of public services. The citizen report card is a tool to collect citizen feedback on public services from the actual users of the service, not opinions from the general public. So this is actually targeted for the citizen that actually uses that service. If it's Umeme electricity, that is the target, not the general public, but the citizen that uses the service. If it's maybe Uganda Railways and people who use other service, it's actually targeted to them. It also assesses the performance of the providers across sectors. So it may be like maybe you're assessing the performance of Airtel and MTN service. So those are the providers, Airtel or MTN. So the citizen report card is made to assess feedback from the Airtel users or MTN users on how the service actually is to them, whether it's accessible, it's usable, or the costs, all that. We shall look more into it. So there is a very broad application of the citizen report card. One is assessing the performance of service providers. As I said, it can provide valuable information about the coverage, quality, efficiency of a service delivery across a wider range of issues. As I said, quality, coverage, and efficiencies you can look at networks, communication networks. You can look at National Water. This is all a service, and you can assess the coverage, quality, and efficiency of such a service using a citizen report card. Also, it can be used in cross-sector comparisons, where it can be used to compare performances across sectors. For example, a survey can be used to compare user perspectives on the quality of National Water, UNRWA, and the Ministry of Health. So you can compare the different sectors in terms of the quality of service they provide. So here you can decide that I'm going to use a citizen report card to compare how does UNRWA, the service of UNRWA and National Water, deliver their service to this citizen or public compared to how UNRWA does it. And can we learn from them? Yeah. Or comparing Ministry of Health and Ministry of Education, comparing different sectors. Also, it can be used in intersector comparisons. These CRE are useful for comparing service provider performance within the same sector across sub-regions or regions with a country or province. For example, a CRE could examine the performance of health centers in the different regions. So here you're going at the sector level. You can decide that I'm going to compare the performance of Kawempe Referral Regional Hospital compared to the Gombe Referral Regional Hospital in Uganda. Yeah, so you can compare how both these hospitals provide their services. Are there any challenges? Are they accessible? Yeah. How can we improve? Or what are the different learnings from the different health centers? So that are the broad applications of citizen report cards. Like one I've mentioned, assessing the performance of service providers, doing cross-sector comparisons and intra-sector comparisons. So what are the M&E functions? What are the monitoring and evaluation functions of the citizen report card, which in this form I'm going to use the CRE. Yeah, results are obtained from these types of analysis can be used for a variety of purposes by M&E, such as program evaluation, assessment of the impact of sector reforms, and determination of baseline service delivery levels. Yeah, if maybe we are starting at this delivery that we started, maybe national water, we've found that the coverage in national water is so far more, they've covered the central region, and maybe the north is still lacking. There you've done a baseline, so you know that we need to improve more accessibility to national water in the north. Or like for example, maybe we've done a citizen report card and we've noticed the eastern and northwest or northern region are still having a lack of access to the Wameme, or that's when you come up with the rural electrification project. So these come up with the baseline surveys or delivery models where you can come up with new policy reforms or new interventions just to make a public service accessible to the people. Also, improvement of efficiency in delivery of services. Yeah, why we do the citizen report card to improve the efficiency in delivery of service of delivery of services as M&E, and also assessment of performance across sectors or geographical regions. So other areas where you can apply the citizen report card are in water and sanitation, solid waste. All these are public goods. Police and security, street lighting, road and local transportation, health and education. Like you've seen that recently KCC did a citizen report card asking about the challenges of the road safety, and then that's how they came up with the road safety policy and funding to support some of the roads that are so bad in Kampala. So those all are outputs or benefits of the citizen report and why it's always done. Compile such reforms from the citizens or the users of the good themselves. It's also a useful tool, as I said, to establishing sound baseline information, and also it's very effective when they're employed at different levels, either municipal government, where there is a space between the citizens, that is the clients, and the service provider is minimal. So this can be either done at national level or regional levels. Yeah, that's it about application. So how do you design the citizen report card? You have three phases of designing the citizen report card, that is assessing, planning, and prepare. Under assess, you have to analyze the context and assess the applicability of where you're going to do this citizen report card. In this case, you may find that maybe as KCC did recently, one concluded they assessed that most Kampala roads were really very bad, and then they assessed there was an increment in the number of accidents. So they analyzed the situation and then did the citizen report card. What is actually causing this? Are there so many bad roads, so many pitfalls? Yeah, so you determine, you also, in assessing and planning, there you've assessed your context and its applicability. So you know you're going to run this citizen report card in maybe in the Kampala central city. Yeah, the roads, you're looking at the road transportation system in the Kampala central city, which is your scope also. Then you determine your scope. The done scope is going to be Kampala. Then you mobilize resources of when this is going to be done, the surveys, and you set timelines, and also identify partners. It's very good to identify partners. This can be NGOs or other international implementing partners that can help you in running these surveys, and also supporting the recommendations or findings after, and also engaging the whole process to own it. Yeah, then after you've assessed, planned, and prepare, you collect your information. Yeah, you prepare for a survey, select a sample, and design a field test questionnaire. Yeah, so after you've done the analysis, you determine your scope, you have the resources, you prepare your survey. You select a sample that maybe you're going to look at 2,000 citizens. This sample is going to be taken from 2,000 road users. Yeah, when you field test your survey questionnaire, if it's going to be a questionnaire, you do a field test to make sure there are not any errors, how the responses, if there's anything to change, you change. Then after you administer the survey, you collect the data, and you analyze and translate the data into a user-friendly format where you can easily communicate the findings. And after you disseminate and institutionalize the information, and in here you organize a dissemination campaign, like what KCC did. Yeah, KCC is going to be our example, that after they did the citizen report card about the road safety and usage and issues that were arising, they organized a sequential campaign, engaging all the media about it, inviting NTV to cover the coverage, that this is what it found out, this is causes and issues, these are how many road users have been affected, how many accidents have been affected. And in this case, they had a partner, that was a thing from the UK, who was supporting this, and they supported the campaign. And after the campaign, it's ran a whole campaign because the roads were really very bad, and the government decides to give 5 billion to settle some of the issues on the road safety usage and the poor roads. So after that is dissemination. You've organized a campaign, you're making sure the voices are being heard, the partners that are responsible also are hearing this message, and that's why you can sustain your momentum for change, that there is need to change these road rules and road safety, and maybe improve our roads and create other road safety, sensitize people. And after you institutionalize your changes. Yeah, so that's the process of us designing a citizen report card. Yeah, as I said, assess, plan, and prepare, which I have explained. Yeah, so just the 9 critical factors for you to consider when you're doing your assessment, planning, and prepare. 1, you have to consider the political setting, whether it's favorable. Decentralization, that is where you can engage, is it from the regional or a national? In this case, it was a regional thing for the Road Safety Act that was given, and usage and protection by KCC. Then you have to consider the security. Will there be security for the people who will be engaged in this? Is there a citizen's freedom for voice? You have to engage that, because this is affecting the citizen most. So if there is no freedom of voice from the citizen, then you won't probably get feedback on your CRE. Presence and activism of our CSOs. Do I have some implementing partners that will help me or back me up when I'm doing this? NGO professional activity. Yeah, NGO, as I said, the quality of media, is that the media represent the truth of what is going to be maybe aired in case they find the services are not good. The improvement with the support, this initiative or survey, the leadership and orientation of the service providers. If maybe you're doing a CRE on the service providers, a particular good, for example, it can be National Water. Are they in tandem with this? Are they supportive of this? And also government interests. Is the government looking at this keenly, or it's just looking at it as a minor issue? Those are 9 critical factors you have to consider when you're assessing, planning, and preparing for your CRE. So further, your team might analyze the socio-political context at the assessment stage, which are still including the 9 factors to determine whether the CRE will be an appropriate accountability tool to use. It's also very critical to understand the objectives and limitations of the CRE at the outset. This helps the team to know what information can and cannot be elicited from the citizens as users of services, and also information about corruption related to the bribes taken from the citizens can be easily captured by a CRE, but corruption in awarding of contracts cannot. So you have to keep that at the back of your mind when you're assessing and planning for a CRE. So to continue, as I said, I explained earlier, you determine your scope. After you plan, you determine your scope. Where is this CRE targeting, and you establish the upfront of the scope. Is important because it affects the ways in which the analysis proceeds. So you have to be very, very keen at this stage also that as I gave an example, cases was looking at Kampala specifically. Also, you have to know what information your team is seeking, what is the purpose of this CRE when you're planning, what are the issues or problems that it's meant to address. For this case, it was going to address the road safety, usage, and issues that were arising. What is the stance of the community on this issue? You have to know that and also keep it at the back of your mind. It was a big issue then, it is still, but it's a work in progress. Would information obtained by the CRE add value to the existing studies and current action? You have to ask those questions when you're planning your CRE. So also you have to know who, what, or where is the focus of the CRE. Is it targeted toward a single service provider or multiple ones? Is the objective to gather comparative information from a wide range of service providers or not? You have to know that. So if it's objective on a wide range of service provider, you can say that it's a target, its focus on communication networks, and you're comparing Airtel and MTN, since these are the big players in Uganda. How will the information be used? We focus how will we use this, the results of the study. Will it be used to reshape the existing programs? Still, you're planning. Will it be a catalyst for a new program development? In this case, they did the Road Safety Act for that CRE, and the government offered some money to fix the issues. So can it be a catalyst for new program development? For example, when they did the CRE on electrification, they came up with rural electrification as a project. So those are some of the things you have to consider when you're doing your CRE and are coming up with the survey questionnaires. How can the data be obtained? You have to plan your methods, whether they'll be quantitative or qualitative. How will survey participants be identified? You have to know that if I'm targeting citizens of maybe users of national water, this is where I'm going to get the survey participants. Or road users, this is where I'm going to get these survey participants. How will the data be collected? You put in which tools you're going to use, whether you're going to use questionnaires or random interviews. Will it be random sampling techniques, focus group discussions employed? Answer that and also plan for that. You include it in your planning. If I'm going to use random sampling, I'm going to use key informant interviews or focus group discussions, and what level of skills with the staff and field workers required to carry out the surveys. So you have to know this is the field staff I need to carry out this survey, and they must have these competencies. Maybe we're going to hire this for a team. Then you mobilize resources and set timelines. You include the technical skills that are required and also identify the partners. So normally the CRE in the design implementation, it can take 6 to 12 months when you're planning the CRE. We've seen that government takes its time to do that, because these are mostly, I said, public service based. Pre-survey activities can take approximately 2 to 3 months When you're doing pre-surveys, then data collection and entry can take 1 to 2 months. Post-survey analysis and report writing can take 1 to 3 months. And then the determination of findings and initiation of advocacy campaign can take 2 to 4 months. As I said, still the cases is still an ongoing advocacy campaign for road use and safety. Yeah. So in identifying your team or partners, you must determine who will implement a CRA. In some instances, these can be implementation responses are given to some NGO staff or contracted firms or credible government entities. Phase 2, in preparing for data collection, as I said, you just prepare your survey. Normally you can use mixed methods, qualitative or quantitative methods. You set the objectives of the exercise, integrate the quantitative and qualitative research approaches, you select the CRA preferred designs, sample and field test your tools. These are normally in standardized templates. Then you collect your data. After collection of your data, in collecting information from the CRA, the criteria has to be like, you have to gauge the access to this service. Access, it can be in terms of a service. I said many services can be UNRWA, national water, electricity, public goods. So how many on it, you're maybe designing your collection, your survey instruments, you want to determine access to a particular service. These are some of the questions. You can say how many members of a given population have access to the particular service. For example, this service can be like national water. How accessible is the service? The analysis can further be integrated to capture locations, among locations, gender, maybe how many people in the north have access to national water, how many women or men have access to water, what is the age group. These are the social demographic factors you can go into deriving access to a service. How many ethnic groups have access to that service. Then you also have to determine usage, where access exists. If you determine that, okay, this is the access area, how many people have access to that, how is the usage, to what extent is this service being used in the particular area or by a particular group, what are the reasons for non-use, where it exists. You're understanding that. All that you have to include when you're designing your CRA survey questionnaire. Then quality, how satisfying or useful or relevant is the service to the client, and what is the technical quality of the services. And then reliability, the service being delivered in accordance with the stipulated schedules or specifications, their derivations from the norms. So frequency of the problems and responsiveness, how often do respondents experience service problems. For example, this can be like maybe how often if the respondents maybe from Nigeria experience a service problem, maybe we say that it's a big problem, that it's on and off. They complain about it. If so, to whom does the problem get resolved quickly? You're understanding that if I make my complaint about maybe that, if where normally our power is on and off, and can take even 2 days without being off, how long does Omeme respond to it? You understand. You can say maybe it responds immediately or it takes its time, and then you know how to counteract the issue. In service and opportunity costs, what costs if there are any respondents barring to poor service, including first investment in alternative demands, unauthorized payments, frequent travel over large distances, inconvenient delivery schedules. So service and opportunity costs. What costs does someone go through to access the service? For example, frequently you can see that in Uganda here, the whole service or whole systems are still, the access and usage is still low. Access to when you go deep down in villages, very many have a low access to healthcare services or health centers. You can find that in a whole village, someone has to walk like 5 kilometers to get access to a health center, and then you find that is the opportunity cost. That what costs what cost do I give up to access this service, that I have to walk this like 5 kilometers to just access the health center, and you may find there are no drugs in that health center. So you're analyzing all the situations. Then transparency and service provision. To what extent do service providers practically disclose the norms and standards related to this service? And to what extent is the corruption of the service in delivery faced by the users? We've talked about that. Corruption cases are rampant, and how you want to counteract them. First, you do your data collection, you administer your survey. The team should draw the answers on questions in time in the scope question above. Targeting stratification decisions should be based on a variety of factors: geographical boundaries, demographic, and service. Larger samples generally are preferred, but must be balanced with time, budget, and staffing. Larger samples give more a balanced view and a balanced view of the findings, but normally you have to balance them with the time you spend, the budget, and the staffing constraints. Then you analyze and translate your data collection into questionnaires. These are entered too, as you know, as an M&E, entered this in a database and analyze them. Typically, respondents rate or give feedback on aspects of government services using a rating scale. So normally they use rating scales in these survey questionnaires, rating the service. The ratings are aggregated and translated into a satisfaction score in form of a percentage. So this is the statistical information that should be included in the CRC. The findings that emerge from this process must then be translated into user-friendly formats, allowing citizens to quickly understand the findings. When you do your analysis, you got your findings, you have to also make reports that citizens can easily understand. So examples: satisfaction results, satisfaction with services. This is a sample analysis that was done of citizen satisfaction with services of power company. The surveys were 1,036 households were surveyed, and for a car, the agents was a power company. We see the number of users that were interviewed were 1,027 users. From the responses were 47. These were turned to a citizen report card percentage, where you see 14% were satisfied with the service. Then water use, you see that 871 were interviewed, and 42% were satisfied with the service, and 18% were dissatisfied with the service. Then we see telecom comes 424 were interviewed, and 67% were satisfied, and 7 were dissatisfied with the service. National roads 174 were interviewed, and 27 were dissatisfied with the service. KCC Development Authority 38% were dissatisfied with the service. With the police 26% were dissatisfied with the service. So these are the summary of survey results of the citizen report card that was done, comparing different sectors of service providers of services to the citizens. When phase 3, disseminate your findings. Here, you disseminate your findings to the key stakeholders. You share a conclusion on particular report using the media, the relevant agencies to disseminate these findings. Before you disseminate your findings, you have to allow people who have been engaged in this process, maybe if it's a service providers, to respond to some survey results in advance, because of this wider release. To also increase the chances that the authorities will agree to partner for a future change. So in case there is some negative feedback on some service providers and CRE you've conducted, you have to give them an opportunity to actually respond to some survey results. So that give out results that are balanced. These results are always going to be on the wider view, wider scale, engaging all citizens that have involved, media coverage. So there you're also building a rapport where that these partners, since they own the results, they've responded some of the concerns, they also own a future for change. Yeah, so if there is any change that they need to do, maybe these providers will own it and they will do the needful in the changing. Yeah, so some good dissemination practices for the CRE. One, prepare press kits that include short, readable stories, media-friendly press releases, and copies of the final report translated into local language. It's a very effective approach. Also, following the publication of the CRE survey findings, service providers and users should meet and discuss the key issues. This not only allows for constructive dialogue, but also puts pressure on service providers to improve their performance prior to any subsequent surveys. Then findings should be constructively critical and should not aim to embarrass or laud any service provider's performance. The media are your biggest allies in determining these dissemination efforts, so use them. In sustaining momentum for change, yeah, the CRE will not in itself enhance service delivery performance. It's crucial that your CRE teams collaborate with citizens, CSOs, and service agencies themselves to use the CRE results as the basis for promoting sustained improvements. Since the CRE surveys are usually conducted multiple times in order to monitor change in service delivery performance, the dissemination of results should aim to drive the reform process forward in a systematic fashion. For example, you have to do awareness campaigns or public dialogues, request to service providers that they make their public comments with regard to the improvement of the service delivery. They commit themselves to improve service delivery. For example, in this case, we are committed itself to improve the roads construction. You have to continuously monitor these service providers or CSOs and the media and their commitments. Do town hall meetings between government officials and citizens. There you're sustaining your change. And also integration of CRE findings into the governmental policy processes. Yeah. Still, you're under sustaining dissemination and sustaining momentum socializing changes. Efforts should also aim on educating stakeholders about the CRE methodology and the kind of insights it can provide. Enhancing the capacity of CSOs to monitor service provider performances. Yeah, you have to do that. Yeah, maintaining regular interaction between the users and providers to assess the service delivery performance. Working with service providers to integrate independent assessment of service delivery outcomes to broader performance. Helping clients develop internal monitoring and evaluation systems that can be used to track and analyze and utilize performance-related data produced by CRE. And also incorporating CRE into the governmental processes using a tool for analyzing results of national development planning and integrating CREs into your local monitoring, government monitoring toolbox for services under review. So that is it about dissemination, sustaining, and institutionalizing your change. I said in institutionalizing, efforts have to be in educating the stakeholder about the CRE. Enhancing capacity of CSOs, maintaining regular interactions, working with providers. Yeah. One, most successful CREs have 3 phases: assessment, planning, and preparation. Technical information collection and information dissemination. Each phase is very critical to the success of the CRE. Yeah. So that's it about the CRE. Like, share, and subscribe to my channel. Thank you.